Paz de Dios y abrazo de Nuestra Señora la Virgen del Pilar y San Jose a todos. Assalamualaikum wa rahmatullahi wa barakatuh. Director Paisala Butasil, Local Chief Executives, participants, muchísimas gracias por la oportunidad for choosing Zamboanga City to share our best and good practices to fight against COVID-19. Indeed, it is quite difficult, especially now as we are under the surge of the Delta variant. In the year and a half of fighting COVID-19 pandemic, our response was hinged on a whole of a nation, whole of a city, and whole of a family mindset. We realized that no matter how much we set the restrictions, people tend to be frustrated and tired at all of these restrictions. That is why we have to put the emphasis that we need to be responsible citizens by being responsible members of a family, the family that we go home to and the family that we love. It was also important for us to align our COVID-19 response with the national directives, but also for it to be grounded on the realities and needs of the local level. Currently, Zamboanga City and the wider region confronts the menace of the Delta variant, with the more infectious iteration of the SARS-CoV-2 in Zamboanga City. Cases shot up in the highest level on October 17, 2021, with 2,858 active cases, causing further stress to the city's already flustered healthcare system. Data from the City Health Office indicate that the bed occupancy in the hospitals is approaching the critical level at 84%, while the isolation facilities are at high risk with the occupancy at 81.7%. We would have wanted to put up 2,500 isolation beds, but COVID has taken its toll on Zamboanga City. Hindi pa kami nakarating sa 2,500, almost 500 to 600 isolation beds are already full. Oxygen supply remains insufficient as patients wrestle for access. Cognizant of the dire situation, we called upon the National IATF to grant an MECQ status for Zamboanga City from October 16 to October 31, 2021, which was granted to us. The MECQ status reinforces the PDITR strategy of prevention, detection, isolation, treatment, and reintegration. Prevention through electronic quarantine pass, the local government instituted the use of the quarantine passes to limit mobility and exposure of the vulnerable population. There are two types of passes. A and B were issued to eligible residents where the quarantine pass A are only allowed to move out every Mondays and Wednesdays and Fridays, whereas quarantine pass B permitted only on Tuesdays, Thursdays, and Saturdays. Sundays were dedicated only to frontliners and the worshippers. The initiative was first instituted in the early 2020s, with each family being given a quarantine pass each containing a main holder and an alternative holder. In May 2021, when the city was again placed under MECQ, the Computer Services Division developed an electronic quarantine pass, or the EQ Pass, with a QR code to accommodate requests by returning residents and the families whose quarantine passes were lost or damaged beyond repair. The application process for the e-quarantine pass is completely online, with the only requirements being a valid proof of identification such as government-issued IDs, barangay certification, or birth certificates. Compliant applications are issued EQ passes within 72 hours. Thank you to Jessie Lapinid and the team of Alan Aizon as well. The Research Statistics and Evaluation Division of the Office of the City Planning and Development Coordinator oversees the e-Quarantine Pass project with routine inspections and monitoring of establishments, checkpoints, and markets to ensure strict observance of the measure. Prevention, COVID-19 online data tracker or the geotagging and the map of containment zones. As part of risk communication, an online data tracker was also developed in May 2020. The tracker aims to provide the public with the up-to-date and accurate information on COVID-19 infections and status of hospitals and care units. Available in the website are the executive issuances on COVID-19, statistics on vaccination, video advisories, and COVID-19 news beats and information. The local government was also one of the few local government units to collect coordinates of the patients infected with SARS-CoV-2 under the geotagging project. Around 40 barangay-based and 15 citywide geotaggers constitute the geotagging team who regularly submit coordinates to the City Planning Office via email. The spatial data collected are processed and sent to the IT team to be made available in the online tracker where the risk map is being shown. Aside from a risk map, an interactive map of areas under the granular lockdown are also made available in the tracker, including information of the number of individuals vaccinated by the barangay. In this age of information, data can be powerful and a very effective tool to influence human behavior and minimize the risk of infection. Other prevention mechanisms include routine disinfection, mobilization of Barangay Information Operations Network, Stay Safe or QR codes, and negative RT-PCR requirement on borders, regular COVID-19 advisories, public information office info sessions with different sectors, and stringent patrols and checkpoints down to the barangay sita. Detection. The local government unit molecular laboratory locally hired contact tracers. On detection, the local government unit early on worked on the development of an LGU-managed molecular laboratory to increase our testing capability. From having to rely on testing laboratories in Manila and Davao way back through the RITM, the local government coordinated with the establishment of 5 functional testing laboratories. In the Philippine Red Cross, we also came up with a MOA, Ciudad Medical Hospital with another MOA. Then there is the West Metro Medical Center, the Zamboanga City Department of Agriculture Laboratory, and the Zamboanga City Medical Center Gene Expert Laboratory. Now, the local government is close to realizing our in-house molecular laboratory as we look into the conduct of mass testing and free testing for vulnerable sectors. I know in areas like Pagadian, we hear that there is also free testing. We learn from each other. Aside from testing, the local government unit has also seen significant feats in contact tracing. With the guidance of Mayor Benji Magalong, the contact tracing ratio has significantly improved to 1:21 with 750 locally hired contact tracers strategically stationed in different barangays of the city. On the pipeline, we are also looking at activating our eSumbong and eConsulta as part of our detection strategy. In isolation, we are putting our mega isolation facility. The local government is proud to have forged partnerships, especially in the aspect of isolation facilities. Early on, the Ateneo de Zamboanga University, the Yuntes Mission Center of the Archdiocese of Zamboanga, the Zamboanga Economic Freeport Zone, and the Department of Public Works and Highways extended a hand for the use of their respective facilities for isolation. We are currently finalizing arrangements for the use of selected Department of Education schools to increase our capacity to isolate mild COVID-19 patients. Additionally, the Pasunanca Convention Center, Mindanao Central Sanitarium are on our way of our mega isolation facility as well to provide the much needed additional bed spaces to reach our target of 3,000 beds by November 2021. On quarantine, the local government was one of the few local government units who provided a subsidized hotel accommodation for returning residents with free meals to provide our locally stranded individuals and returning overseas Filipinos with a breath of comfort amidst the stressful pandemic protocols. Moreover, the Disaster Risk Reduction Management Office is unwaveringly working with the CSWDO and the barangay local government units in the implementation of granular lockdowns and containment zones pursuant to our OCD guidelines. Treatment, the PPEs for medical workers, vitamins to boost immune system. In support of medical frontliners, the local government continues its provision of PPEs to health workers assigned in hospitals and treatment facilities. With 36 million worth of special risk allowance for the health workers, and the LGU provided 20% premium for job order employees, manifest the commitment of the local government unit with the national government through the Department of Health to support our COVID frontliners. Supplements to boost the immune system are also provided to our frontliners to increase protection against severe illness. The local government also coordinates with the agency partners to supplement the insufficient oxygen supply and the mechanized ventilators. While the One Hospital Command is being set up, reintegrate welfare goods and cash assistance provided as are part of our strategy. The assistance provided by the local government unit extends even after recovery from COVID-19. Survivors are given welfare goods and or cash assistance to help them get back on their feet. Mental health sessions are also given to restore our mental health balance and faith in the new normal. As far as our vaccination program in Zamboanga City, with over 401,694 individuals receiving at least one dose of COVID-19 vaccinations. Zamboanga City has been lauded by the Department of Health for its efficient administration with fewer than 1% wastage and consistently timely consumption of allocated doses. Magpabakuna tayo! In 2021 annual budget, the 200 million pesos has been allocated for the purchase of AstraZeneca vaccines to ensure an efficient supply for the people of Zamboanga. A few of our good practices in vaccine administration include the Libreng Sakay for senior citizens and PWDs, Island Vaccination Program, and the planned mobile vaccination drive. Of course, we thank our partners in the national government, LTFRB, and LTO as well for the Libreng Sakay. We are eternally grateful to our partners for volunteering, offering their services as vaccination centers. SM Minpro, KCC Mall de Zamboanga, Western Mindanao State University, Ateneo de Zamboanga University, Universidad de Zamboanga Medical Center, Zamboanga Chongwa High School, Ciudad Medica Zamboanga, Zamboanga Peninsula Medical Center, Doctors Hospital, West Metro Medical Center, Brent Hospital and Colleges, Zamboanga City Medical Center, Camp Navarro General Hospital, as well as Zamboanga City Electric Cooperative. Recently, we have launched a VaxCert booth at SM Minpro to serve OFWs who are required a vaccination certificate in their destination countries. Other good practices are the administration's whole of a nation, whole of a city, and whole of a family approach on COVID-19. That does not end with the support of the health system. We have also been unwavering in assisting the local economy, especially the most affected sectors. Since last year, we have implemented the economic relief programs to affected sectors to adapt to the new normal. Number 1, the discount on real property tax. Number 2, the discount on business tax. Number 3, the condonation of rental fees. Number 4, Kadiwa on Wheels for agri-products. This has been a model for us to encourage our fisher folk, our sembradores farmers to be able to provide nutritious food from the bounty of the earth and sea to the homes so that we will be able to fight the pandemic by eating healthy and supporting the livelihoods of our people. We also had a subsidy program for power and water bills. Nagbigay po kami ng 500 pesos for our consumers for their electric and water bills. Number 6, e-learning hub for the Department of Education. These hubs provided for a television camera, printing for our capslet and modules so that every child will have at least their own module. Presently, we religiously host the daily huddle every single day to coordinate the everyday concerns on COVID-19. Guiding our policies are data analysis, surveys, and studies prepared by the City Health Office Surveillance Unit and the Research Evaluation and Statistics Division. Fighting the pandemic has been an immense and complex and totoong napakahirap na challenge, particularly for leaders and the mayor on the ground. We need to prioritize over multiple needs and demands for the services as we work toward the recovery and resilience with limited resources. Communication is also a challenge with the prevalence of fake news, COVID fatigue, and increasing distrust in government and government institutions. Maraming galit, maraming disinformed, at maraming anti-government. Kaya po, moving forward, it is clear that governance, recovery, resiliency are shared responsibility that is no longer the sole domain of government. If we want to win against the pandemic, every father, every mother, every responsible child should be able to contribute to the minimum health protocols. We need to build a data-driven culture to meet the needs of the city on human security, social welfare, and disaster prevention. We also need to empower and strengthen the local government units and increase our capacities to assess, to plan, and mobilize resources in response to disasters and challenges. Alam niyo po, nahihirapan po kami kasi yung mga tao ayaw magpaswab. Takot silang magpaswab. And unfortunately, because of the refusal to swab, nagiging critical at sometimes it leads to death. Ano po kayang dapat natin gawin for our people to be able to allow themselves to be tested? Libre naman po ang swabbing. We need to help each other because this is one way that your good practice will be able to contribute to the saving of our lives of our people. Local government units must be ready to face and handle the emerging trends and issues brought about by the pandemic. Now, more than ever, we need to build and strengthen people's trust in government by being transparent and accountable. The work is not yet over. I have barely 8 months more to go and serve as mayor of Zamboanga City in a very crucial time, from the Zamboanga siege, the humanitarian crisis, to the global pandemic. But we take confidence in the fact that each day brings us lessons and opportunities to recalibrate our responses towards better governance and more resilient cities. Kapit tayo sa Panginoon. Before I end, I would like to honor and recognize my fellow local chief executives in the forefront of our COVID pandemic. For the past year and a half, we have been holding the ground in the frontliners to fight this pandemic. Muchísimas gracias at mabuhay po tayong lahat. In this pandemic, I have learned very important lessons. That the pandemic is indeed quite a challenge. But we have a loving and powerful God who will be able to beat and win over the pandemic. Kapit lang tayo sa Panginoon. May we have faith in God, in Nuestra Señora La Virgen del Pilar, our true Mother and Mayor, and let us hope in the new normal. And above all, let us love our family. Ito po si Beng Climaco na nagsasabi, I love God, I love Zamboanga City. Daghang salamat kaayo. Muchísimas gracias. Shukran. Y vaya con Dios a todos. Laban tayo kontra COVID. Kurada, kumida, busca vida, y bakuna. May we have faith in God, hope in the new normal, and love of family to heal the sick and feed the hungry and provide the needed vaccines for our hope and our future. I'd like to end with Jeremiah 29:11. For I know my plans I have for you, says the Lord, plans to prosper you and not to harm you, plans to give you hope and a future. Kapit kamay tayo, laban at kapit sa Panginoon. Muchísimas gracias y vaya con Dios a todos.